Chapter 13, An Introduction to Urinalysis. Urinalysis is the physical, chemical, and microscopic analysis of the urine. We do a urinalysis to aid in the diagnosis of diseases and to monitor wellness and to monitor any sort of kind of therapy that may be happening. So an example of this would be diabetes. It's often caught just on a routine screening when glucose is present in the urine. So monitoring the health of a diabetic would be checking for ketones and glucose in the urine on a routine basis and any sort of proteins that could indicate some sort of renal failure or issues with the kidney. And you can also use it as a way to monitor to make sure that the diabetic is being effectively controlled. The test performance can be done manually or semi-automated or fully automated, and we'll talk about those just a little bit. So with any other part of the lab, there is a quality assessment, quality control portion of it. For urinalysis, some of the pre-analytical things that we look at would be anything related to the patient, how the specimen was collected, the identification of the specimen, and making sure that it's properly labeled when you receive it to the lab, making sure that it's transported properly, and making sure that it's preserved properly. Was it refrigerated? If it was a particular type of analysis, like a 24-hour urine, did it have the proper preservatives added to the container? For the analytical aspect, we look at the use of the reagent strips, control solutions, how the reagents, how the strips, how the QC, everything is maintained and stored, and making sure that the use of refractometers is QC'd, although most labs do not use a refractometer anymore. Making sure that QC is performed daily, making sure that all your reagent strips are QC'd when they're put into use. So some of those things like that is what would be your analytical variables. Post-analytic would be making sure that everything's documented properly, that it is reported out properly, make sure that your results from your reagent strip correlate with how the urine appears, as well as what it is on the microscopic portion of the test. So the urinary system consists of 2 kidneys, 2 ureters, 1 bladder, and 1 urethra. So with urine, we're looking for the function of this whole system. So the functional unit of the kidneys is the nephrons, and this is where urine is actually formed. It goes through that process of exchange to making sure waste is removed and nutrients are maintained. The formed urine flows from the kidney into the urethra. It's through the ureter and it's passed to the bladder and then down through the urethra for the final emptying of the bladder. The main function of the kidney is to remove waste products. So anything in your body that's a waste product. So this could be excess glucose, or it could be any sort of drug metabolites that need to be removed from the body. And also it will retain nutrients. So certain nutrients that the body may need a little more of, it's going to keep those in there. So it maintains that balance. Keeping the acid-base balance so that you're not too acidic within your body itself. It maintains the water and the electrolytes, making sure that you stay dehydrated. Of course, you know, if you're outside and you're sweating, then with losing that sweat, then you're usually going to urinate a little less unless you're still maintaining that fluid intake. And it's also part of hormone synthesis. So an example of this would be beta-HCG, or the pregnancy hormone. Once that builds up a level in the body, then it will start flowing over and being excreted. And there's also some other hormone functions that you'll learn about when you get to your urinalysis class more in depth. So these functions are carried out by means of filtration, reabsorbance, and secretion. So it's going to filter out the urine. It's going to keep what it needs and reabsorb that back into the bloodstream. And it's also going to secrete what you don't need as waste product as part of the urine. So the kidneys are a very complex unit. So within them, there are several things that work to filter the urine, or to filter the blood and produce the urine. And so one of those is the actual nephron. There's several of them within one kidney. And so those nephrons, which you can see a picture of here, when it goes through each of those, it has a specific thing that it does as far as exchange process. And you'll get more detailed information about this once you get to your urinalysis class. So normal urine has very few cells in it as far as like red blood cells or white blood cells. And it may also have a few of the cells that line the urinary tract itself. It does not have, or very little of, protein or cast. However, normal concentrated urine can form normal crystals. It just depends on the chemical makeup of the urine and how it's stored. Refrigeration tends to make these crystals appear. And so with that, you will learn the difference between normal and abnormal crystals. And if there are a lot of crystals that form, it can present with a cloudy, turbid looking type urine. And so being able to correlate that aspect of the clarity of the urine with what you actually see on the microscope will be some things that you'll learn once you get into your actual urinalysis class. Normal urine is negative for blood, nitrites, leukocyte esterase, which is produced by the white blood cells, glucose, ketones, and bilirubin. So identification of the fluid in the urine or the chemical makeup is done by several ways, by measuring urea, creatinine, sodium, chloride, which are all significantly higher in urine, and this is what kind of stands urine out from body fluids, because again, it is your waste product, so anything excess is going to be removed from the body through the urine. So with collection and processing of urine, you want to look at fresh samples ideally within 30 minutes. However, it's not always feasible that a urine can be processed right away. So in those situations, it would need to be refrigerated or with some sort of preservative. So an example of a preservative would be a preservative for any sort of sample that's being submitted from a doctor's office for a bacterial culture. So you don't want the bacteria to grow and replicate more than what it is and give a false sense that there's more bacteria present than really is. And another example would be a 24-hour urine. So specimens like this, they are typically refrigerated, but there are some analytes that can't be refrigerated, so that they may require a certain preservative to prevent those analytes from breaking down. Some of the urine specimen types that we will test in the lab would be a random specimen. So this would just be any time of the day for any reason. So this happens a lot when you go to the doctor's office, that you'll show up and they say, can you give us a specimen? And so that would be considered a random specimen. First morning would be the first urine after you wake up, which has a lot of hormones in it. So this is why it's recommended for pregnancy tests that you do a first morning samples, because it's more concentrated. It's sat in the bladder for a long time overnight, and it'd be easier to detect lower levels of hormones in a first morning sample. Midstream clean catch. So this would be starting the urine. Of course, you would clean first and then start the urine, and then midstream you would catch the urine. So you would catch it shortly after you start, but before you finish. And then 24-hour or timed specimens. Timed would be a particular point in the day, and so sometimes this is used for hormone monitoring. or a 24-hour sample, you would collect it for a 24-hour period. So usually first morning sample all the way through the next morning is what you would collect for a 24-hour urine. And this would be to look at different analytes and how your body breaks them down and synthesizes them. A cath specimen would just be, as it states, the patient will be catheterized, which helps to ensure a clean urine, that there's no sort of contamination from outside skin contaminants. Suprapubic would be actually sticking a needle in through the stomach and going into the bladder itself. And of course there are pediatric specimens. And because, you know, children can't urinate, or infants can't urinate on command, then they usually have a bag that's attached to the child, and whenever they urine it would collect in the bag, and then the bag is taken off, and then that specimen would be examined. So collection containers for urine would consist of something like just a regular urine collection cup. So you can see that here in this top image. And most of us are probably familiar with going to the doctor and given a urine specimen in a cup similar to this. Urine collection tubes, those would be something like a tube that you see here where the urine specimen is placed in this tube. And depending on what's going to be done with it, if it's just for routine urinalysis, or in this case would be for a culture. So this tube would help, number one, give a smaller sample, so you're not sending a cup that could potentially leak and have some sort of cross-contamination. And number two, it has a bit of a preservative in it to keep that bacteria from multiplying and replicating. A 24-hour container we saw on the previous slide. So the patient would collect their urine for 24 hours, and like I mentioned, it may be refrigerated, or it could just have a preservative in it that helps to keep those analytes from breaking down. So you could have a routine specimen, it could be timed, and of course it could be collected specifically for doing a culture to see if there's bacteria causing an infection. So some urines, the decomposition of things in the urine can begin within about 30 minutes. So making sure that it's timely processed, or that preservatives are added based on what you're looking for. So there are some chemicals that are added to that urine container that helps to keep that preservation intact. And another alternative to preservation would be refrigeration, to keep any of those elements from breaking down, which could give false results. One of the physical properties of urine that we look at is volume. So abnormal volumes would be something like polyuria, where you have a consistent elimination of an abnormally large volume of urine, which will be like 2,000 mLs over a 24-hour period. And you would assess this by doing a 24-hour urine on the patient and measuring the volume of the urine output. Diuresis would be an increase in urine volume, even if it's just temporarily. Oliguria is excreting an abnormally small amount of urine, and this would be less than 500 mLs in a 24-hour period. So again, you would do a 24-hour urine collection and measure the volume. Anuria would be complete absence of urine formation, so you're not making it all. And this would be something that would definitely need to be investigated, and potentially it could be a situation where the kidneys are failing and dialysis would need to be started. Nocturia would be excreting more than 400 mLs of urine throughout the night, so waking up, going to the bathroom. We also look at color and clarity. And so here's some examples of color. So you see at the bottom where it starts off with a light yellow, and some people may refer to this as straw. And then it goes to yellow, amber, red, brown. And you can see some variations of this, plus some additional colors that are found within the urine. And urochrome is what gives urine its yellow color. With clarity or transparency, we're looking to see if there's any sort of elements in there that's given it any sort of turbid look. So typically urine would be clear. However, it can have some slight variations of being cloudy. So it can be slightly cloudy to turbid. So this right here that you're seeing with color and clarity will be part of your lab assessment that you will do for your campus lab. So with color of urine, like I mentioned, there's a variety of colors that you can see. And here's just a list of some of the causes of the different colors that you can see. So for example, a pale urine, sometimes close to being colorless would be something that's very dilute. So it could be that someone diluted it themselves, or they could just be a person that drinks a lot of water, and so they've kind of diluted it out by drinking so much water. Something like green, blue, orange, those can be medications. Birth control sometimes can cause a greenish tint to urine, or it could be something like a bacteria like Pseudomonas that's causing a green color, or it could be certain medications like the pyridium that you can take when you have a urinary tract infection that gives it that bright orange color. Red could indicate that there's blood. So there are a lot of different things that can contribute to the color of urine. And so being able to correlate that with what you see on your strip or what you see under the microscope is something that you will learn in your urinalysis class. When we look at clarity, if it's hazy, cloudy, turbid, and it could be things in there like mucus, or it could be some sort of crystal, it could be bacteria, it could be white blood cells, red blood cells. So there's a lot of things that can make the urine lose its transparency. With odor, even though we don't really report odor, it does kind of help us correlate what we're seeing on our reagent strip and what we're seeing in the microscope. So some examples would be a fruity odor, could be ketone bodies, typically with a diabetic. Or if you smell a real foul odor, it could be an indication of something like bacteria. So sometimes too, like things that you eat, like asparagus or cabbage, coffee, those things can also give a scent to the urine. So some of the routine tests that we do would be doing a reagent strip test. So with our reagent strips, it's a plastic strip that has little pads on it, and each of those pads has a chemical in it. So when the urine is introduced to those pads on that test strip, then those pads will absorb the urine and a chemical reaction will take place, and then you look for a visual color change. So you always want to follow the manufacturer's instructions, and you want to make sure that you are wetting the pads as the manufacturer suggests. One pad in particular, the glucose pad, has a really hard time absorbing. So making sure that you fully submerge that pad is one of the things that you need to be very aware of, that it has gotten saturated. Storage conditions need to be properly done so that you're not having any sort of contamination to the strip, humidity, any kind of moisture getting into that bottle can affect those pads. Leaving the top off allows the humidity in. It also allows light in, which can also fade those pads as well or break down the chemicals in them. You need to make sure you're aware of the stability of the reagent strips. Depending on the manufacturer, it may expire after it's been open for so long, like after you've actually opened the container and started using it. And it could be that you need to also make sure that you're using the strips within its expiration date, not only the open expiration date, but also the manufacturer expiration date that's printed on the label. You need to make sure that you properly time your reagent strips. So each of those pads has to be measured for color change at a particular interval. So usually starts off at 20 or 30 seconds, depending on the manufacturer, and may go all the way up to 2 minutes. So each of those pads has a different time frame that it has to be read in. And you need to also make sure that you're running controls daily or per shift, depending on where you're working. And with each bottle that you open, you need to make sure that you're running controls to ensure that the reagent strips are always reacting as expected. So here's an example of doing a manual chemical test in urinalysis. So with this, you'd remove a strip from the bottle, and that's depicted up in the corner with image A. You would dip the urine, making sure that all of the test pads are fully immersed and that they are covered with urine. And then depending on if you're reading it manually or if you are putting it on an analyzer, you may need to blot it. Certain manufacturers don't require that you blot it on the side. And so you would just pull it out and you would rim it across the top of the urine cup and then blot it on its side. And then you are in image C. You're comparing those changes for that reagent strip. For each test pad, you're comparing it to the color chart on your bottle and documenting what color change that you see, which could indicate if something's positive or negative. So these chemical reagent strips can come in a variety of combinations, but the most common that we use is to check for glucose, bilirubin, ketones, specific gravity, blood, pH, protein, urobilinogen, nitrite, and leukocyte esterase. When we look at the microscopic analysis of urine, what we do is take the urine specimen and we put it into a special centrifuge tube. It's usually a plastic tube, and then it gets spun down at a high speed. And what it's going to do is concentrate that urine. So all of those elements that are in the urine are pushed down to the bottom, and this is referred to as urine sediment. And what you do is after you centrifuge it, you will pour off the top part of it, or the supernate, and then that will leave the concentrated sediment at the bottom. And so usually you pour off until you leave about half to 1 ml of urine with that sediment, and you resuspend it so that you have something that's sort of liquid so that you can place a drop onto a glass slide with a cover slip, or there's special systems that can be used. For an example, Cova system is a brand name of a type of slide that you can use to look at the urine under the microscope. And what we look for is cells like red blood cells, white blood cells, epithelials. We look for cast, crystals, sperm, and any sort of microorganism like bacteria, yeast, parasites. And we also observe for any sort of artifacts that may be present as well. So here you can see the urine was placed into a tube, it was spun down, and then it's being poured off to leave about 1 ml at the bottom. So you can see that in picture A and picture B directly under it. This person is adding a dye reagent to each of the tubes so that they can observe certain elements a little bit better with dye. And a lot of times this is just preference. A lot of people don't like to use the dye, some people do, so it's just preference as to whether or not you want to use it. Then it's loaded into one of those special slides I mentioned. So this is a Cova slide. You can see that in the top right hand corner, image C, where the urine specimen is being loaded onto the slide. And then D, you will look at that under the microscope and look for some of those formed elements. So some of the things that we look for would be red blood cells. So in fresh, normal urine, they typically have that biconcave shape to them. And see an occasional one, less than 5 per high-powered field is normal. However, if you start seeing a lot of them, then it could be associated with something like some sort of urinary tract disease like glomerulonephritis, or it could be a contaminant from menstruating. White blood cells, the presence of up to 5 per high-powered fields can be seen in normal urine. However, if you start having a large amount of white blood cells, then this can indicate some sort of inflammation or infection within the urinary tract. Squamous epithelial cells is just an example of some normal skin cells. So these look kind of like little fried eggs. So they're large with a little nucleus, can be in the center or off center. And so these are just normal cells that slough off of the urinary tract. However, if you do see a large number of them, it could indicate that the specimen is contaminated. Cast are cylinder-type structures that form by the solidification of protein in the lumen of the kidney tubules. So seeing a hyaline one, which is in the upper left-hand corner, it's not abnormal to see an occasional one of those, but you can see how they look like little tubes. So the upper right-hand corner is a hyaline. Next to it in the, left-hand corner is hyaline, right-hand corner is a granular cast. The bottom left is a white blood cell cast, and the bottom right is a red blood cell cast. So seeing some of these other ones would be abnormal, and it could indicate certain things going on with the kidney. But you can see that they look like little tubes or like a cast off of somebody's arm. Crystals, occasionally you can have crystals that are normal. So here you see some images of some crystals that are normal: calcium oxalate, triple phosphate, and uric acid. So these can form with the urine being older, being refrigerated. So seeing something like this may not necessarily mean anything, but seeing abnormal crystals could indicate something else going on within the body, as far as some sort of abnormal metabolite type thing going on, or the presence of some sort of stone forming. So you can see them as a normal part of urine, but you can also see them as an abnormal part of urine. But knowing the pH of urine helps to identify these crystals, because certain crystals form at an alkaline pH, whereas some form better at an abnormal acidic pH. So here you can see some images of bacteria. Bacteria are very small, so it does take you a little time to get used to seeing those. If you see a high number of one particular organism, then it could be that that patient has a urinary tract infection, and this would be indicated by a presence of a lot of white blood cells as well. However, if you see a lot of bacteria without white blood cells, then it could be a contaminant from possibly something like normal vaginal flora. Trichomonas would be an example of a parasite. And so this little parasite is sexually transmitted, and you can recognize it because it is kind of, it is a flagellate, so it actually moves around with flagella, so you can see it moving around in the urine, especially if it's a fresh urine. If it's a little bit older, it's kind of hard to tell the difference between trichomonas and a white blood cell, but as you get more experience, you will get used to that. The appearance of yeast, of course, yeast bud, but they can be confused with red blood cells. So you're always looking for that mother-daughter cell where the yeast is kind of budding off and pinching off. And seeing yeast in urine can be associated with diabetes, but it can also be a contaminant from the vaginal secretions as well. So making sure that you correlate yeast with your reagent strips is very useful. Mucus, of course, the urinary tract is a sort of mucous membrane, so it isn't uncommon to see mucus strands within the urine. You just have to be careful not to confuse those with cas. You can see sperm in both males and females. So typically you're not going to report sperm unless it is something significant like a young child, or maybe if you see reporting sperm in a male could be significant depending on the health status of the man. Pinworm eggs could be seen as a cross-contamination from feces, so noting that in urine would be significant. So when we look at urine, red blood cells, white blood cells, and cast, it's not abnormal to see an occasional or a few of those, but once you get to higher numbers is when it's significant. Same with epithelials. You could see an occasional one, but if you start seeing high numbers, then it indicates contamination. Bacteria, there should not be any bacteria within urine, nor yeast, nor any sort of abnormal crystals. And with males, it could be present, so it's really up to the provider, the physician, to determine if, according to the health status of the man and what they're looking for, whether or not it's considered clinically significant. Automation in urinalysis can be done by a variety of methods. So we have semi-automation, where you dip the urine strip and you place it onto the analyzer, and the analyzer looks for that color change of that reagent strip. And there are several manufacturers out there with several different types of analyzers. So depending on where you go will depend on what you use. Then you have fully automated systems where you put the tube on and it looks at the color and the clarity, and then it also measures the chemical tests. And then you also have machines that do automated microscopy. And so a lot of hospitals are starting to get these instruments in, so it's a very good chance that you'll get to see this when you go to clinical, where the analyzer itself will take pictures of the formed elements and it will put them into a category, and you'll get an actual number similar to a CBC.